Hi there, my name is Kristen. Welcome to my channel. Um, I am doing this video, the first of many, to kind of document my progress. Tomorrow I'm having, actually 2 days, I'm having weight loss surgery and having the gastric sleeve, the vertical gastric sleeve, as you might have heard it, or the vertical sleeve gastronomy or something. So I'm having that on Tuesday, July 25th, 2017. And I have been in the pre-op stage for months. And throughout the time that from when I decided I wanted to have this surgery till leading up until now, I've actually chickened out a couple of times. So even though my insurance said that I needed to go through at least 6 months of, seeing a nutritionist and then do all of the other stuff, jump through the fiery hoops and um, run through an obstacle course. It's basically really complicated to try and get this surgery, to justify that you need this surgery. So throughout all of that and throughout all the research that I've been doing, I've chickened out a couple of times. I got scared and I thought I could do it again on my own. And I tried, even though I've been going through this now, I'm 39 years old. I've been overweight since I was a kid, since maybe seventh grade. Um, I've been trying to lose weight since then. I went to Weight Watchers when I was 12 for the first time, and I've been doing stuff like that ever since. And now I'm 39, and after trying and succeeding and failing so many times, I worked up the courage and did all my research and decided to go give it a really good um, try to get this done. Especially when I found out that my insurance, which is Medicaid, covers the insurance. So I went to the office. I found a really great surgeon in New Jersey, where I'm from. I'm in Bergen County, New Jersey. And in Bergen County, a couple towns over from where I live, is a surgical group that is associated with a nearby hospital that is that is certified bariatric center of excellence. And in order for me to get the surgery covered by my insurance, they required that I get it done at a bariatric center of excellence, which is fine by me because any type of major surgery, you want the best people doing it. So when I went, I saw the doctor for a very brief consultation, and then they passed me over to see the bariatric patient coordinator, who basically does everything for you, tells you what you need to be doing, tells you who you need to go see, and submits all of your information to your insurance company. And since they deal with every kind of insurance out there, she was really knowledgeable about the specific things that the insurance company needed. And she was super nice. And, you go in there and you feel very vulnerable. And I felt, I'm just speaking for myself, but, if you can relate to this, that's good, because that's why I'm making this video. I went in there and I felt very vulnerable. I felt embarrassed that it had come to this point, that I wanted to get the surgery. I felt judged, even though they weren't there to judge me. They were there to help me. So it was a mixture of emotions. And as I'm sitting in there and basically leaving myself open for a world of hurt, I was like spilling my guts about my history of weight loss, and being obese and emotional. Sorry, the video just like meh. Um, it was very emotional to be there. So when I left the first consultation appointment, they gave me a folder full of information about how the procedure was going to go. And actually, the first time I went was last year, sometime in the beginning of the year, like over a year ago. And so this says April 2017, and it's because they had to start me over with a new folder because I threw out the old one because I was like, I'm not getting this surgery. So in this, this is the patient manual for laparoscopic sleeve gastrostomy surgery. And I read this thing cover to cover, and then they give you a list. The patient coordinator gives you a list of the things that you're going to need to get done. And this is obtain letter of medical necessity from like your primary care doctor. Mental health clearance has to be established. Just basically, really not a big deal at all. I was sweating it until I actually did it. You have to go to a licensed, you have to go to a psychologist or a psychiatrist. It can't be a counselor or like a social worker. I made that mistake, and I had to go do a whole bunch of stuff over again. And I'll describe maybe in another video what the process is for that. And then it says you have to do nutritional clearance. You have to see a nutritionist for 6 months, and they just want to make sure that you have tried everything. And my nutritionist she was very sweet. So every time I went there, she weighed me. She discussed proper nutrition, and she basically talked to me as if she was just preparing me for how life is going to be after surgery. She wasn't trying to cure me of my fat sickness, and she wasn't trying to convince me that I didn't want the surgery or that I didn't need it, which I really appreciated. The next one is 6 months of medically supervised weight loss. And that kind of actually went along with what the nutritionist was doing. But it's kind of like the way they word it, you're not on a weight loss program. And just in my case, I don't know if they make you try to lose weight like that. Maybe if you are really, really overweight, like they want to make sure that you can lose weight. And if any of you have watched 600-Pound Life, which is, I'm obsessed with that show, morbidly obsessed. I know that the surgeon wants the patients to try to lose weight, to show him that they can lose weight. So maybe that's what that meant, but that wasn't my experience. Next is I have to go to one preoperative surgery support group, which I did, and it took place in the same hospital where the surgery is going to take place. And a bunch of pre-op patients were in that meeting, and they just went over what to expect, even the types of feelings you're going to have afterwards, like how you're going to feel physically. They outlined everything down to the very last detail about how things are going to go. And you have to do that before you have the surgery. Then it says that, 3 post-operative support groups. So right after the surgery, I think my first post-op support group thing is 1 week after I get out of the hospital, but I think that I have to do one in the hospital too, because I'm going to be there for 2 days. Then the preoperative testing, they give you a prescription and you go to the hospital and they do a venous ultrasound, which is basically the veins in your lower extremities. They want to make sure that the circulation is, you have, good circulation, I guess, they don't want blood clots happening. And so they just want to check for that. They also do an EKG just to check your heart out. And they do a bunch of blood tests and they weigh you and stuff. And it's really easy. It takes a while. And the venous ultrasound is not pleasant. It's like if you've ever had a baby and you go for an ultrasound, that's a piece of cake. This thing, they dig the ultrasound thing into your leg. And I guess if I was skinny, they wouldn't have to push so hard, but like he really wanted to see the veins. I felt a little bit humiliated, or because I'm so body conscious. Then the last thing was other primary medical clearance, which is different from the letter of medical necessity. your doctor, the same doctor that does that, needs to do, it needs to see all the blood work, and he needs to give you the final clearance. Now, I had a little bit of a trip up before I got that, um, and it really was kind of frustrating because I thought I was completely ready to get the surgery. And then they let me know that the nurse at the surgeon's office said, yeah, your hemoglobin is low, and the hospital requires you to be at a 12 hemoglobin, and mine was like 9.6. So she's like, you have to see the hematologist. And I go to my doctor, and he told me, you don't need to see the hematologist. You only need to go straight to the hospital um, and get iron infusion treatments. So I was scheduled for 5. And over the course of 2 weeks, I had all 5 iron infusion treatments, which if you have to do that, enjoy it, because all you do is you sit there for, it's basically 2 hours, an hour, a half an hour of like fluids in your body, and then they switch to the pouch of iron, liquid iron, and then a half an hour of observation after. And you're just sitting in my hospital, you sit in this recliner. They give you food if you want it. Dear, you hungry, dear? And I'm like, yeah, what do you got? And they put a warm blanket on you, and it's like, because actually you do get cold in there because they're putting these chili packets out of the refrigerator into your veins, and of course it's going to go through you and just like bring your temperature down. So get the blanket. Um, then they did my blood tests 1 week later to check my hemoglobin. Now, you really, after getting something like that, you should wait 2 weeks, but I was a little bit like chomping at the bit to get this done. So I actually, they did it 1 week after my last treatment, and my hemoglobin only rose like 1 point to 10.6. And I was really upset because, like, to me, I was starting to lose hope. And the doctor said that he was going to clear me anyway because he didn't see any reason, like my iron levels were normal. He didn't see any reason why I wouldn't be able to get the surgery, because that is a normal for some people. 10.6 was my normal, and there was no reason why I couldn't have surgery safely. So he wrote that letter of clearance. And then the nurse calls me back from the surgeon's office. She's, yeah, we got that. That's fine and everything. The letter of medical necessity or clearance that he wrote is over 30 days, so you need to get another one. So I had to go back to the hospital and get more blood work. I called my primary care. I had them write another updated clearance. And then she tells me, she says, oh, your insurance has changed some of their rules. So in order for you to be cleared, you need maybe another test to prove that you have another comorbidity. So, which is something like you also have asthma, maybe the beginning stages, or full-fledged diabetes. You know, it's not just the fact that you have a certain BMI, a high BMI. And so then so we needed to go and get an ultrasound on my liver, a liver ultrasound. I was like, what the heck is that? And basically they were just checking to see if I had a fatty liver. And I read up on it, and I was like, I said to my husband, I was like, no way, I don't have a fatty liver, because I don't have any of the symptoms, and I don't hardly drink any alcohol, and I don't have diabetes, and this is just such a waste of time. And I go, the guy that did the ultrasound was a different guy. He was really handsome, and I was like, oh my God, why? And I'm lying there in all of my glory, and he's pressing the ultrasound very uncomfortably, like right under my ribs on my right side. And he's looking and looking. I almost felt like, because I was nervous, I was like going to crack a joke and say, hey, is it a boy or a girl? But I decided against it because I just couldn't. So finally, the test results came back almost a week later and said that I did have a fatty liver. So, I mean, I kind of wanted to be happy about it, because I thought, yeah, I'm gonna get my surgery now. And I did get approved. But on the other side, I was like, geez, I wouldn't have even known that had they not done that test for this purpose. And, if I had just kept, letting it go, um, who knows how it would affect me? Because I actually have epilepsy and I've had it since I am 12 years old. And I take medication every day of my life. I'll take it until the day I die. And everything that you take into your body goes through your liver. And my aunt, who also had epilepsy, she had liver failure because she was not getting her liver checked. And she passed away because of complications related to epilepsy. And so I was shocked. I was happy. It was like a big mix of emotions. And then, like, one day later, the patient coordinator called me and she said, "Congratulations, you're approved." And this was like, I don't know, Tuesday, like last week. And I was like, "Good." And I said, "The only thing is, and she knew this, I told her this before, that I have to have the surgery by the end of the month. And I know you only do surgeries on Tuesday. So I have to do it by the end of the month because my Medicaid expires on the last of the month and I didn't get a renewal. So I'm going on my husband's insurance, but who knows when that's going to happen." And she's like, "Yeah, it's okay. I squeezed you in. It's going to be a week from now." And I'm like, "What?" So I had to tell my husband to take the couple days off. And, I had to tell my mother and my sisters and stuff. So it was a very hectic thing. And in the middle of all of this, I got married yesterday. So I've been totally stressed out. I started seeing a therapist like a couple of months ago to help me to work through the problems of my emotional eating and, fears that I have that are holding me back in my life because I want to be successful at this. And I'm really making a lot of progress. So I told all of this to my therapist and she was like, "That's a lot of pressure on you. Just you have to kind of take it easy. Make sure you take time for yourself." And I completely agree. You have self-care is a huge part of getting through this process. I always took the time to fit it in there somehow. Like if I go get a manicure, every 2 weeks I get a manicure. I make sure I take time for me to rest in whatever way that I need to, because if you don't take that time out, you're going to wind up like me in the car having a panic attack, hyperventilating because your whole world just seems to be crashing down on you. So after that, they gave me some more information, some like pre-op instructions. Pre-op. And this says everybody's doctor has different requirements, but mine only requires me to do a clear liquid diet 24 hours before the surgery. So Tuesday's my surgery. Monday is when I'm having my doing my clear liquid diet, and then at the end of that day, it says no food or drink from midnight on to the next day. It says not even water. But my doctor said that I can take my epilepsy medication with a little water, like right before bed, and it should be fine. So it says that when discharged from the hospital, you should continue on clear liquids when you come home until you see the doctor on your first pre-op visit, which is going to be 1 week after you have the surgery, not after you leave the hospital. That day, the doctor will tell you when to start the protein shakes. You can't start the protein shakes until you're cleared because your body's healing and you're changing your anatomy. And when you do that, everything's going to be, there's going to be inflammation. There's going to be discomfort, and you don't want to rush the stages of the diet because just because you're getting bored with the liquid or the shakes or whatever. So because it could be extremely dangerous, life-threatening complications. I mean, like you don't want that. And weeks in the hospital. The doctor will tell you when to call the dietitian to prepare for the puree stage, which sounds so much fun. there is a class at 11 a.m. on the Friday of the same week that you see the doctor, and that's like a post-op class. Then it just, this is for gastric bypass and sleeve diet. It says stage 1 diet is water in the hospital for the whole day. So you get to have water all day long. It's great. Um, Stage 2 of the diet is clear liquids in the hospital. Like Jello is actually considered a clear liquid. Clear soup, bone broth. And I would recommend anything with collagen in it because it really helps the digestive system heal. But clear liquids, as long as they're not sweetened. And stage 3 is clear liquids and protein. So that's a protein shake the day after discharge. Yeah. 4 days after surgery, continued for 2 weeks. Stage 4 is puree, 18 days after the surgery, continued for 6 weeks. 6 weeks, man, month and a half. And then you get to move on to the last stage, which is regular stage 5, 60 days after surgery. You get to do that. 60, yeah. And diet and nutritional guidelines. Following bariatric surgery, your stomach will only be able to hold 2 to 3 ounces of food at any one time. Beverages cannot be consumed during meals. And so that's going to be a challenge for me because I'm used to drinking immediately before and, throughout my meal. So to not be able to do that is going to be a challenge. Large pieces of food will not pass easily through the stoma, the opening from the pouch to the intestine. And you need to choose soft foods and chew foods very well when your diet progresses to regular texture. So you have to chew it until it's basically a paste because you don't want anything getting stuck. This is what I've been told by my dietitian, that you have to chew it into a paste. And throughout the 6 months that I was seeing her, she made me practice that and be conscious of every bite that I took. I'm a very fast eater. I could just wolf down a hamburger. I could win a contest. Stop eating if you feel pain, fullness, discomfort. It says that food will empty from the stomach much slower than before surgery. And the most important thing is hydration. 6 to 8 cups of water a day. And right now I don't even drink that because I always forget. And plus I don't really like water and I like to stay away from any artificial sweeteners. And sometimes it's hard to find something flavored with, sweetened with stevia that actually tastes good, even though I like stevia. So I think I also can't have coffee, not in the beginning anyway, and that people better stay away from me in the morning. And then vitamins for the rest of your life. I don't think that'll be so bad because I'm already used to taking pills day and night every day. And then all the information they gave me breaks down what exactly is in each stage of the diet. And right before, like maybe today or tomorrow, I'm going to go to the supermarket and I'm going to get the clear liquids. So they gave me a list of examples of clear liquids, and so that it's going to be interesting, and that's why I'm doing this video and then others to document my progress. Crystal Light, herbal tea, diet gelatin, water, vitamin water zero, Weiler's diet lemonade, vintage fruit refreshers, sugar-free Kool-Aid, broth, consomme, ocean spray light juices, miso soup, which I think is way too salty for anybody, for me anyway. Fruit 2.0, country time, diet lemonade, Luigi's no sugar added fruit ice, decaffeinated tea, Propel water, sugar-free ice pops, diet Snapple, smart water, and Neo flavor enhancer. So I got to get some of those things. And, we're not to these other stages yet, but at least I have all of the nutrition. Your your dietitian, your nutritionist should be able to give you samples of some of the protein shakes that are available, because you're going to want to try them out before you buy them. Before you buy a ton of them, there's ones that are super gross and there's ones that are good. She gave me Unjury, like injury, but with a U, Unjury. And that was really good. I tried that one. I've tried some from GNC, and they're okay. I mean, I basically don't like them, but if I'm not going to be able to eat anything else, and I have to, I will get used to it. No gummy vitamins, because no, they have a lot of sugar in them. They gave me a whole list of different supplements and stuff that I have to take. You know, they even give me a shopping list of things that I want to have home when I get home after my surgery. You know, yeah, protein powder shakes. So yeah, now it's Saturday. My surgery is on Tuesday. I'm not sure what time the surgery is, because they told me that Monday, the day before the surgery, when I'm doing the liquid diet, somebody from their office is going to tell me when my surgery is scheduled for and what time to arrive at the hospital. So today, well, yesterday when I got married, we had a very small wedding, but we had a nice family dinner at my favorite restaurant in Edgewater, New Jersey, right on the Hudson River. You could see the city. It was a beautiful, perfect day. And what was on my mind? Like, I got married, yeah, whatever. But what was on my mind was eating. Like, I will not be able to eat for a while. So I had filet mignon. I had, a big Caesar salad with croutons. I had, the cake, the piece of cake they gave me was enough for 4 people. And for a minute, I considered maybe not eating it all. But since it was kind of like my last big meal, I ate it. And then today I had like fries from Shake Shack, and like a veggie burger that was really good. And I had a brownie from Starbucks, and it's like, I'm gonna go out. If I'm gonna go out, I'm gonna go out with a bang. And then so tomorrow, me and my husband are gonna go to one of our other really favorite restaurants and have like my final meal before surgery, because you'll be able to eat food eventually, but you'll never be able to eat a lot of it. So I don't know when I'm going to go to a restaurant again. And I don't like to cook, and we eat out a lot and we order in a lot. So, I'm kind of just not looking forward to that, but it's worth it. It's going to be worth it. And in my living room, my family room right now downstairs, and I have an elliptical, which I plan on using the heck out of. And so I'm ready for this. I've been ready. I was born ready. So I guess that's it. That's it for this video. My hair is still glamorous from yesterday. I probably won't be wearing it like this ever again. Actually, I got it done at the salon yesterday, and they were saying, "Oh, what beautiful hair you have. We could do so much with this." And I was like, "Thank you." But the whole time I was thinking about everything that I've heard on the Facebook support groups for weight loss surgery and gastric sleeve, is that people have problems with hair loss. And I had asked my surgeon about that, and he says, "Well, you should take a biotin supplement and start taking it as soon as possible." So I went and I got that, and I'm taking that. But I don't. I think I'm gonna lose some hair, and I'm upset about that, because I've heard way too many people do experience that, even though it grows back. And when I had my daughter, when I was pregnant with her, my hair was luxurious. I was like flowing and shiny. I mean, kind of like this. But then when I gave birth to her, and I was going back to my normal hormone levels, I lost a bunch of hair. Like at times, big handfuls of hair. Not like this, but like enough to make you really freak out, kind of anxiety. So, you know, if it happens, it happens. I'll do the best that I can as long as I know that it's going to grow back. And if it doesn't, well, then I know that there's some pretty awesome wigs out there. Um, so, anyway, I hope that this was informative. I hope that you can relate to the things that I'm going through. I For anybody that's contemplating this surgery, it is definitely not the easy way out. You know, I've had a lot of judgment from my family and my friends, and the only people that really know are my family and my friends, close friends. I haven't said anything on Facebook about it. There are a lot of people out there that they just don't get it, and they're never going to get it. Even my mom, she just was like, "Don't get it. Can't you try to lose weight regularly?" And I mean, she's my mom. She loves me and she's known me my whole life, but she's never been obese, never in her life. So she doesn't get it, you know? So what you need to do, and what's been helpful for me, is to surround yourself with people who get it, you know, who have been heavy for the majority of their adult life and teen life and childhood. But you need support to do this. And my husband, we're together now 11 years, married for 1 day, and he gets my struggle. You know, he has never been as obese as me, but he's been heavy, you know, chunky. He thinned out in his 20s, but you know, we're on the same page about this, and he fully supports my decision to get this. He wants me to be happy, and you want to surround yourself with people that want you to be happy and support your decision. And if you get flack for it, just know that you might not want to hear it, and they might not understand what you're going through, but their worry is kind of an expression of love and concern. So, you know, just take it. Take their and just be like, okay, I hear you. I know you care about me, but I'm going to do this. And, you know, I just hope that you'll respect my decision. Um, so if you like this video, give me a thumbs up. And if you have any questions, put them in the comments. So, because I'd like to know if this video helped you at all, and if I can help you in any way, please let me know. Give me a thumbs up, smash that like button, as my friend says, um, because I want to know if I should make more videos like this. The next video that I do will probably be in 2 days when I'm on the liquid diet, and then post-surgery, I might do a video while I'm in the hospital. So yeah, so that's it. Thanks for watching, and good luck to you.